2-week pregnancy update. At this point, my baby is the size of a small cabbage. He's growing really fast, and at 10 weeks left to go, I'm excited and nervous all in the same time. Since the last time I've spoken to you or put up a video, I have had a few complications that I want to talk to you about. I did have to go to the ER with bleeding. After doing testing and checking the baby, everything was fine with the baby. They're pretty sure that the bleeding came from my placenta previa condition. If you haven't been watching my other videos, the placenta previa is where the placenta is between the baby and the cervix. Actually, the placenta should be up a little higher and not between the baby and the cervix. So with it being so low, certain things can cause bleeding, and that's where the bleeding was coming from. Since then, I have had a little bit of spotting, and nothing really to be concerned about. The baby's fine. Another thing that I've been experiencing still is my iron levels. I'm still having issues with my iron being low. At my last doctor's appointment, she spoke to me about having IV iron treatments. From reading up about this, it seems as though it's similar to a chemotherapy treatment where you go in, have an IV treatment of iron, and then you go home. I have been taking the liquid iron supplement. For those of you who have never taken it or maybe considering taking it, I just want to let you know that it is pretty harsh on your body, especially being pregnant. Some side effects I've had is extreme nausea. Heartburn is horrible with liquid iron. Sometimes it makes me more tired the day that I actually take the iron. But that's me. Everybody could be different. I just am having a pretty hard time taking the liquid iron. At my next doctor's appointment, she's going to let me know if my iron levels are still low enough for the IV iron treatments. So at my next update video, I will let you know how that goes, whether or not we decided for me to go on with the IV iron treatment or if I'm going to continue with the liquid iron. The baby is growing and moving so much. He moves all the time, especially when you lay down at night or right after you eat. He curls up in a ball. And as a paraplegic, I use my stomach muscles a lot, my abdomen muscles. I rely on them a great deal. My level of injury is T12L1. In case you're not familiar with the scale, that's around my hip area. So I do have the muscles in my abdomen, my stomach, and the top of my hips. The problem that I have found with pregnancy is that with this big belly in the way, those muscles don't exactly work the way that they used to. The belly's in the way, so sometimes I do have a hard time getting around or transferring because the belly's in the way, and I have always relied on those muscles to give me that extra boost because I don't have the use of my legs. So that's one complication from being a paraplegic that I have found. I am having a little bit of problems transferring as far as picking myself up and scooting over. It's just not as easy because of the weight gain. I've noticed, kind of sliding or maybe hitting my rear end a little bit, which I have to be careful about. So that is another issue that I've discovered as being a paraplegic and being this far along in my pregnancy. Transferring issues do get a little harder because of the weight gain so fast, and I need to lift some weights or something just to catch up with the weight that I'm gaining. So far I've only gained about 20 to 25 pounds. It doesn't seem like a lot, but for someone who is normally pretty thin and doesn't weigh much, it is pretty big for me, and the weight gain is kind of slowing me down a little bit. I've noticed that pushing up my ramp to get in my house or pushing up a ramp at a public area is kind of a meaningful task. It does wear me out and make me tired. When my husband or my son is with me, they kind of push me and give me a little bit of extra boost to help me out. When I go shopping at the grocery store or Walmart, big department stores where it's a large area to get around, when I use my manual chair, I do get tired easily. My stomach starts to tighten a lot. That's another thing. I get this tightness in my belly where the baby is whenever I move around and use those stomach muscles a lot. And I remember having that with my last child. So I'm not really sure if that's making my stomach contract a little bit, or if it's just those muscles, or the baby just saying, no, don't do that. So I'm not really sure. I guess I need to speak to my doctor about that at the next appointment. A solution that I have come up with for shopping and going a long distance, especially in public areas, most places here offer what I call a scooter cart. It's an electric buggy. I just transfer into one of those and drive around. It's a lot easier on me, and I can keep up with my husband and my child. Normally, I will not get into one of those if it's just me and my son. I have a problem leaving my wheelchair with someone, and there's not really a way to go. I haven't figured out a way to go get the scooter and bring it back and put my wheelchair back in the cart. It's a lot easier when I have someone else with me that's not a 4-year-old. So I only use it when I'm with someone else that's a grown-up. So other than the iron, the bleeding, and the tightness in the belly, the weight transfers, I've had fatigue, which is normal with pregnant women. Heartburn has gotten worse. I'm assuming because the baby has gotten bigger and he's pressing on my organs, and I already sit, so everything's kind of pressed up to the top. I've been experiencing those issues. My feet are swelling. To doctor that or remedy the feet swelling, I have been wearing my TED hose, which is what I've always called them. They're also called support hose. They're basically like pantyhose you wear on your legs. They increase blood flow. If you are reading my blog, there is a post that I have on those and about the different benefits just being a paraplegic from wearing those from time to time. I will post a link to that post down below, so if you're interested in reading more about those and what it has done for me, check out that link below on my blog. So let's get into the fun stuff. We have not picked a name. We have not decided. We are having a boy, in case you haven't watched my other videos. We have an idea about the name, but we're not quite sure yet. But as soon as we decide, we will have a name announcement video for y'all. I'm going to be launching a video just about how ZJ feels now about being a big brother. The last video I posted of him, he wasn't very happy about having a baby brother. He wanted a sister. So stay tuned and make sure you're subscribed so you can see how he feels now a couple months later, see if he's changed his mind or not. We will have the baby shower in just a couple of weeks. I will do a video showing, you know, what I received and maybe do some footage from the baby shower. The nursery reveal will be coming up soon. We are currently working on that and a theme, so stay tuned for that. I do have another doctor's appointment coming up soon. I'm currently getting to where I have to see the doctor more than once a month, so there will be more update videos. I do apologize that I haven't did a recent update video in a while. We've been pretty busy trying to get our house, finish these projects we have going on with our remodel, I have been having a little bit of complications, and I did have to rest and lay down and keep my feet up with the bleeding and just being really tired and having so much going on. You have to be careful. We do not want this baby to come early, so I have to rest. As usual, if you have any questions at all, you can send me an email, you can comment below, however you prefer. Let me know the questions you're having so I can answer them. Also, if you know someone who is disabled, whether they're paraplegic or not, if they are disabled and they're either pregnant or considering having children, or if it's a male who's considering children, refer them to me, because we can help each other. It may not be an exact similar situation, but we can always help each other, and that is the whole goal for me, is just to help someone. This wasn't available whenever I was pregnant with my first child. I searched the internet, I called people, every resource I had, and I just still was not comfortable, and I just had to learn the hard way. And I'm trying to make it a little easier for other parents out there that are disabled, just to give them a little more comfort in knowing that, you know, a lot of the medical professionals, they think because you're disabled, you have to have a C-section and you have to have all these special things, when in reality, we're just like everybody else. We may have complications and we may not, but I just want to be there for you and your friends and family. If you have any questions or comments, if this is helping you, please let me know. I love comments and feedback. Subscribe if you're not subscribed. We will have a baby within the next couple weeks, so you want to be subscribed so we can share that moment with you, and all the new things that are going to be coming out with the name reveal, the nursery reveal, the baby shower. Don't forget, my oldest son will be coming out with a video letting us know how he feels about being a big brother a few months later after being upset. And if you have not seen the gender reveal video where he reacts to the gender, I will put a link down below for that. It is hilarious and very shocking, so you want to watch that. Thank you so much for watching. I appreciate all of your support, all of your comments, and I look forward to hearing from you soon.